Thank you very much. This has been a particularly interesting conference for me because people are talking about the tobacco endgame and making tobacco history. And one of the things I want to talk about today is the conflict of interest endgame and actually ending the influence of conflicts of interest on research. As we heard yesterday, research is very important to tobacco control. We heard a lot of data yesterday, and it's important that we have the most unbiased data for all of our decisions. So this is my disclosure. I notice we haven't seen these at this meeting, so I have research funding. I'm co-chair of the Cochrane collaboration, but I'm not speaking on behalf of Cochrane today. And those last two disclosures, I might argue later, are not truly conflicts of interest, but they're about my scientific record, which includes a lot of research related to conflicts of interest and influences on the research enterprise. So conflict of interest, I'm talking to the converted here when I talk about tobacco. This crowd definitely knows that tobacco industry funding for research is a conflict of interest, but I want to push your thinking today to think about other types of conflicts of interest that we might not recognize so readily. So we have to all be on the same page. This is what a conflict of interest is. This is a definition from the Institute of Medicine, and it's a circumstance that creates a risk that your primary interest, so what I'm interested in is doing research, that would be the primary interest, is affected somehow by your secondary interests, which might be personal financial gain. That's the example that's most commonly used. What I want to say is it's a risk. It doesn't mean someone's necessarily biased, but a conflict of interest, it's not a potential thing. It's there, and it creates a risk that something might happen to the primary interest. And as soon as you say that, then people get very up in arms. It's a terrible term, conflict of interest. People get incredibly defensive, quite understandably. So many journals, for example, and others have tried to use different terms to soften it. If it's not a conflict of interest, it's a competing interest. It's a vested interest. That sounds like a piece of clothing to me. I never got that one. I like to say financial ties and non-financial ties. And I have to tell you, doing a lot of work internationally, this gets really, really complicated when you're translating this into 7 different languages. Like, what does a conflict of interest actually mean? And so I want to try to change the terminology to actually not make people get so upset when they hear the term. And new things always crop up. There's an acknowledgement from a journal there where they're acknowledging research funding from particular sources. And then at the bottom, they have something called a duality of interest, which acknowledges yet another funder for that research. So I think we still need to nail down the terminology. So why do we care about it? And you in tobacco will know this immediately. Industry funding for research, education, and guidelines is quite substantial. Personal financial ties are growing among researchers and also clinical people. As I said, these financial ties equal a conflict of interest. Doesn't necessarily mean something's biased, but it is a conflict. But we do have quite a bit of data showing that certain conflicts of interest are associated with biased research. So I'll review a little bit of that. And non-financial conflicts of interest are a growing concern, and I want to spend a bit of time today on how we even tease that out and start to talk about it. So what's the evidence? Being a Cochrane person, this is the first question I always get. What's the evidence that conflicts of interest do any harm or influence anything? And one of my goals in life is to do a randomized controlled trial of the effects of conflicts of interest on research. I'm going to randomize people to get $100,000 before their study and another $100,000 personally after the study if they find that the intervention works. Now, nobody has yet to fund this study, but I bet I'll get a lot of volunteers. 50-50 chance you get in the intervention group. So we don't have that kind of evidence for conflicts of interest, but we do have indirect evidence from observational studies, and that's what I'll show you. And most of this is related to the effect of research funding on research outcomes. And we also have very little evidence on how best to manage these conflicts of interest, although that's a growing area of work. And for financial, I'm a glass half full person. We have more evidence than for non-financial. So this is actually, I think, one of the first studies that tried to quantify the effects of conflicts of interest, and it's a tobacco related study I did with Deborah Barnes many years ago, and we looked at reviews of the health effects of secondhand smoke. And it was so interesting to do this because at the time, there were actually more reviews on secondhand smoke than there were original research studies, so think about that. A lot of those were being pumped out by the tobacco industry. So we looked at all of these reviews, there were 108 of them, and we wanted to see if the quality of the review was associated with its outcome, whether it was peer-reviewed or not, whether it was tobacco industry sponsored or not, what the topic of the review was, because the association might have been seen with some cancers and not others, and the year of publication, because evidence actually changes over time. But the only thing here you see that was associated with the finding that secondhand smoke was not harmful was that it was tobacco industry funded. And then it was about 90 times more likely to conclude it was not harmful when you control for all those other things. So there's been a lot more studies done like this. There's been a lot done related to pharmaceutical industry funding, and this is very relevant to tobacco control with all the studies of pharmaceutical interventions. This is a Cochrane review, and each line there looks at an individual study that's examined the association of pharmaceutical industry funding with research outcomes. And what we see here is that studies are about 4 times more likely to conclude that the intervention is effective or safer than the comparator if they're funded by a drug company, even when you control for the methods of the study. So it's not about how well the study was done. We're currently updating this review, and we have about 40 more individual studies to include. It's going to be a huge review. 3 of them focus specifically on nicotine replacement therapies, and they're finding similar findings like this. So what is going on? I've spent 20 years looking at what's going on. I call this a cycle of bias. There's many ways to bias a study. You can bias it through the population you study, by the method you use, and we study this by doing meta-research or meta-analysis. We interview people, do focus groups. It's amazing what researchers will tell you when you ask them, I find. We've looked at how the studies are actually conducted, behind the scenes, and we've done a lot of industry document analyses that tell us what's happening behind the scenes, even if the study is well designed, both for pharma and drugs and environmental risk. Then we look and see whether the study is published in its entirety or not. This is a big source of bias. Often only the favorable looking results get published. And then that feeds back into then the questions. So all of these points, we have copious amounts of evidence showing that sponsorship influences these decision points in the design of a study. And so the tobacco industry in particular has done these strategies. They fund research that supports their position, suppresses research that does not support their position, publishes research that actually may not have been research, it might just be a publication, disseminate research, distort the public discourse about science, and then also set scientific standards. And it's complicated. As we heard yesterday, there's all these mergers and acquisitions among funders of research. So we have a case study I did where we found that Philip Morris had financial ties with both Dow Chemical and Ciba-Geigy. They bought a lot of chemicals for their tobacco plants from Dow and Ciba-Geigy. Dow and Ciba-Geigy made nicotine replacement products. And when they started advertising those products, Philip Morris said, well, we'll no longer buy your chemicals if you keep advertising those nicotine products. And so they radically changed their advertising and toned it down. And this is all documented through industry documents. And there's also a whole series of documents showing that the tobacco industry has a complex network of selling patents for nicotine. Nicotine is not just one thing. There's hundreds of patents. You have to sell them to drug companies. You have to sell them to e-cigarette makers. So the tobacco industry can control these patents. So it's very, very complex. A really interesting part I want to point out here, we've seen, you guys know most of the data on influencing research outcomes. But there's also been great activity by the tobacco industry to collaborate with others to influence the whole process of analyzing epidemiological data. So this is a quote from a tobacco industry document where the tobacco industry outlines 3 strategies for getting data from researchers. The first is to ask them directly. Probably many of you have experienced this. The tobacco industry comes to you and says, I'd like your data, I want to reanalyze it. Here they were trying to get data from Elizabeth Fontham related to a secondhand smoke study. If the investigator says no, they move on to stage 2, which is litigation. But even the tobacco industry, as you see there, admits that litigation is expensive and not always a successful way to get data. So then they moved on to the third strategy, which was to legislate policies in the US for data access and data quality. Now that doesn't sound bad, right? I mean, every researcher thinks we should have open access to data, we should have standards for data, but here the tobacco industry was driving what that access should be and what the standards should be. So long story short, and this is documented in a paper we've done, a law was passed in the US that said that any private company could access the data behind any website or government document. So the CDC had a smoking statistic on their website, and the tobacco industry could get all of that data behind that statistic due to the data access law. And then they could reanalyze that data based on their own quality standards, which were a little different from the Epi 101 standards I learned about. So they had standards for analyzing epidemiological data that were not the norm. And so then they would analyze this data. And what's interesting here is this was not just the tobacco industry. Here's their collaborators on this. We have fisheries and forestry, the National Rifle Association, lots of food manufacturers. So a lot of big companies sponsored this act. And interestingly, there have been challenges based on the act, all come from industry. So this is not something you or I or a public health researcher can use. This is something that a company can use to get data from independent researchers. And all of the challenges and uses of this act have come from industry, although not necessarily tobacco. So I just want to shift gears a little now to talk about the non-financial, because there's been many articles published on this, and I just published an editorial on the non-financial conflicts of interest. And you'll see there these articles define it in different ways, mainly not financial, includes personal beliefs, includes intellectual, your clinical specialty even, whether you're an expert or not, we heard about that yesterday, leadership on boards, just as examples. So the problem here is a lot of these really are financial, like clinical income. It's hard to disentangle that from the non-financial. Individuals may be unaware of their institutional conflicts of interest, where they're working, if they work at a big institution. Self-report is the main way to get this data, and it's very difficult to quantify. But I actually argue that a lot of this is not a conflict of interest at all, because science is not value-free. Many argue that researchers' paradigm, say I'm an observational researcher compared to a quantitative researcher, that influences my approach. I would not say that's a conflict of interest. I would say that's part of your primary interest of how you go about doing your research. I think in many ways the non-financial conflicts of interest are just a big red herring that corporations often use to distract people from concerns about financial conflicts of interest. And much of the information we have on these non-financial are available in the public record. Like if anybody wanted to know what I've published on this topic, it's all in the public record. And that's been very difficult to find out for financial interests. And you can find out people's trainings, their theoretical approach, what paradigm they use, where they are in the academic ladder, if that's an interest. What we can't find out is about people's personal beliefs, past experience, or relationships. And then when you start to think about obtaining that information, you realize how tricky that becomes and what difficulty we might have in truthfully getting that information. This is a big concern about self-reported data, and in the financial area, truth in financial disclosures went up dramatically when we realized we had all of these other data sources for getting information about financial disclosures. So we have physician databases of payments, both in Australia and the US. We have databases on from internal documents, from payments from tobacco companies and drug companies. So all of this data on people's personal financial interests, as it became public, there was less resistance to disclosing financial information. But we're not going to have that for these personal beliefs. Okay, so I've laid out a lot of problems. What do we do about it? And this is where I think we can seriously talk about changing how financial interest and other conflicts of interest are handled. This is the mantra. The first thing is you have to disclose. You have to have accurate disclosures about what the conflict was, how much it was, who it was with. That has to be obtained. There needs to be some independent review, and it can't be by the conflicted person. I'll tell you why in a second. There needs to be some strategy for managing it, and there's two ways to manage a conflict. One is to limit it, and one is to eliminate it. And then there needs to be some way to monitor or enforce this, and this is where a lot of these policies fall down. There's no real follow-through. There's been research on how to obtain complete and accurate disclosures, and unsurprisingly, a structured format works much better than asking somebody, hey, do you have anything to disclose? If you give them a checklist, you get a lot more accurate information. No de minimis amount, so you ask them about everything, and then you have to ask them about when and make decisions about how far back you want to go. Now, this is why you shouldn't have conflicts reviewed by individuals. There's actually quite a bit of data now on this, particularly from the psychology area, but these are quotes from a qualitative study I did where we asked people about managing their conflicts of interest, and I think this sums it up really. People say, I recognize I'm in conflict, I can handle it, I wouldn't be in conflict if I couldn't handle it, it doesn't affect me, I'm the best one to determine if there's a conflict. So that's why there needs to be some independent review of disclosed conflicts of interest. So once there's this independent review, usually what happens is this is the most common management strategy, disclosure. This is very important because we can't find out about any of these financial conflicts of interest if it's not publicly available. It's the most frequently used strategy. As I mentioned, it's difficult to enforce. People still have to be truthful. It doesn't prevent bias in research. And in fact, there's some lovely randomized controlled trials in the economics field that show that when people disclose a financial conflict of interest, they actually give more biased financial advice. It does make readers more critical. So there's been some randomized controlled trials from the British Medical Journal that show that when the same article, one with a disclosure of a conflict and one without, appear, then they are more critical of the one with the disclosure. But it's necessary and not sufficient. So we can limit it or eliminate the conflict. And as you can see, this is one reason my students and postdocs collect disclosures for me, and this is one that came with the email header, worst disclosure ever. It's from a harm reduction journal. And what it does, it not only gives you information on a financial tie, but the authors say that these ties don't influence them, and it's my favorite part is it's just a knee-jerk accusation of bias. So you get these ludicrous conflicts of interest. We still see those. So they're not that useful. So we can reduce the amounts of conflicts. Many organizations do this by limiting the number of investigators or researchers who can have a conflict, or we can just have people who are conflicted not be involved in decision-making about, for example, study design or publication. And then we can also make really good faith efforts to identify unconflicted people. I have a lot of arguments with folks about this. There are unconflicted, very good researchers out there, and often a good effort isn't made to identify them. People go to the same old people they know who may be conflicted. So many organizations and guideline panels are trying to make more of a public call for researchers that meet their criteria but aren't conflicted. And often key public decision makers, lead author on a paper or committee chair should be totally unconflicted. Now, many organizations have just banned funding for research in certain areas. I underline the University of Sydney. That's my new institution, and the University of Sydney has years ago banned tobacco industry funding for research. My old institution, the University of California, still accepts tobacco industry funding for research. So this is not a universal policy, but that's one way to solve the problem. The Cochrane Collaboration does not accept any pharmaceutical industry funding for Cochrane reviews or any funding for whatever company is associated with an intervention that's being tested. We do allow conflicted authors, but they have to be in the minority. So again, those are ways to eliminate. And then some journals actually ban publications that have been funded by industry. The BMJ most recently will no longer publish any education articles that are funded by pharmaceutical companies. So I just want to throw out some case examples because I don't have a lot of solutions here, and I'd be happy to talk to people about these at the break or lunch. But I think the idea is we are making great strides in identifying these conflicts and identifying unconflicted people who can be involved in the research. So does it matter to you if someone had consulting fees from a company, and that might have been one company or 15 companies? Some people say they cancel each other out. I don't believe that. Does it matter if somebody submits a negative disclosure, but information on the person's financial ties you know about from another source? That's a big, big issue nowadays because there's so much public available information. What if somebody has a financial tie with a competing product that's being tested? So not with the product in the intervention, but the product's big competitor. Is that a problem? Most people would say yes. Yes, that person can't be involved in that. What if the person is a co-author on almost every published trial of that product, and those trials are used in a guideline or a review? Is that an issue? It's an issue, but also that's the only evidence available. So how are we going to manage that? Assessing the bias very carefully is one way to do that. They may be an author on an independently funded review, but have all these ties through other, as a trialist or a methodologist. Many people say methodologists can't be conflicted, so as long as you have methodologists involved, it's okay. I'm not so sure about that. There's issues where peer reviewers are selected who have the shared beliefs of the editor, or maybe not the shared beliefs of that are being presented in the paper. That's a problem. So people are often trying to find peer reviewers that are very diverse and who actually have published with dissenting opinions. So that way we know that there's more balanced peer review. Then there's the issue of family members and undisclosed personal beliefs. We really can't crack that right now. So I'll leave you with this cartoon, and like I said, I'd love to talk about some of these scenarios. This is Hilda Bastian writes a blog on statistics that I love. She's saying, by the time the first speaker got to their 9th slide of conflicts of interest, everybody had dozed off, and I think we have to fight that. We're all bored right now, I think, by conflicts of interest. Oh, yet another disclosure. I have to read 15 more pages on that. But it's something we seriously have to think about, and we seriously have to think about how we can remove their influence from research. So thank you.
I find when dealing with conflicts of interest, particularly in the drug regulatory context, there are really different cultures within different groups. So what you find is often in different clinical groups, it's considered completely normal to accept drug company hospitality and money. And when someone working in the drug regulatory area tries to say that is a potential conflict of interest, there's a lot of hostility. I'm just wondering if you could comment on the differences in the culture, but also how one might go about changing a culture so there's more of a shared expectation, particularly an expectation that accords with, I think, more of the sort of public or community feeling about it.
Yeah, that's a great question. And there's actually a lot of data showing that certain clinical professions have a lot more ties to the pharmaceutical industry, for example, than other professions. Dermatology and cardiology are way up there. And I do think it's about changing a norm, and that takes a while. I think the advances that have been made in rules about clinical practice guidelines have really pushed that forward, because many societies now are adopting international guidelines from like the Guidelines International Network, and those are quite strict in terms of the role of conflicted individuals on those committees. So as medical societies, even in very specialized areas where it might be the norm, can't adhere to the international guidelines for guidelines, I think that will really highlight some of the problem.
Lisa, is there any research on how small a gift would be in order to influence a practitioner? For example, the gift of a pen from a drug company, has that been looked at as to how that would alter, say, prescribing practice?
Yes, it has. And actually, there's a whole science of gifts. And so the gift, when you give somebody a gift, it changes how they think about you. So there's an expectation that it's a nice thing to do. And these are mostly data from the psychology literature. And that is even a very, very small gift sets up that expectation. So if you extrapolate that, you say even small gifts at a conferences, pens, a notepad, that's considered a gift that sets up an expectation. There's no empirical evidence to show that that's directly related to prescribing patterns, but from the internal drug company documents we've been able to look at, those tiny gifts are definitely part of a strategy to influence prescribing, and many of the drug companies have internally track the success of these campaigns. And what you see is that even when they start a very small gift campaign, they see enormous increases over time in the prescription of drugs for unapproved indications, because that's their target, to increase the unapproved indications of a drug and not the approved indications. So if you look at their internal document, and there's some on gabapentin and a couple of other psychiatric drugs, you can definitely see that data.